Are you displaying signs and symptoms of cancer? These may include fatigue, shortness of breath, and unexplained weight loss. Skin changes such as jaundice can also be a sign. Others include unusual lumps in your body, pain, or unusual bleeding or discharge. If you're experiencing such signs and symptoms, please go see a doctor. Your doctor will conduct a physical examination to examine your body by looking, feeling, and listening. Your doctor may ask for X-rays, MRI, CT, and/or ultrasound. These imaging tests help visualize whether a tumor is present, the size, and approximate location of it to allow for further tests and treatment planning. The doctor may also ask for laboratory tests to be done. These may include a complete blood count, white blood count, or blood smear, which can give information about infections or blood diseases such as leukemia. ALT can indicate liver damage, which can result in jaundice, a symptom that was previously mentioned. These are just a few tests, but there are many more depending on what your doctor finds is needed. If those results come back irregular and there is suspicion of a cancerous tumor, a biopsy may need to be conducted for more conclusive information. Biopsies take tissue mass from the suspicious site to be analyzed and help diagnose if the tumor is cancerous. In fine needle biopsy, a small needle is placed within a mass to withdraw cells. In core biopsy, a larger needle is used to extract more cells. Incisional biopsy removes part of a visible mass, while excisional biopsy surgically removes an entire mass. Some biopsies may be conducted by inserting a camera into tiny openings. This is called endoscopy. Nodal dissection is really similar to the first three biopsies. However, instead of removing the tumor, the surgeon will remove lymph nodes. Sentinel lymph node dissection is commonly done in breast cancer patients. As shown in the image, a radioactive dye is injected at the tumor site to allow it to flow to the first lymph node, which will be stained with a blue dye and removed. Lymph node sampling removes lymph nodes from various sites to see if the cancer has spread. Lymph node dissection removes all lymph nodes that are at risk of spread from the primary tumor. This is commonly done for head and neck cancer patients. Biopsies are then sent to the pathologist where they will section the mass and process it, which takes around 8 hours. They will then embed the sample onto a slide and stain it commonly with hematoxylin and eosin. Immunohistochemistry is commonly used by pathologists to show whether or not tumor cells have specific receptors by testing to see if specific antibodies will bind to it and cause coloration. This technique can classify tumors, guide specific therapy, and help determine prognosis. Normal cells express tumor markers. However, tumor cells will have an increased number of these markers. These markers are specific to the type of cancer. For example, CA125 is specific for ovarian cancer, HER2, estrogen and progesterone receptors for breast cancer, and PSA for prostate cancer. A pathology report will come back to the doctor letting him know information such as the histology and likely source of the tumor, and whether it is benign or malignant. Malignant meaning that the tumor cells are not well differentiated and do not resemble the tissue of origin. It may also be invasive, metastasize, and grow quickly. This information helps with staging the cancer. Staging is important as it impacts treatment options, planning, and gives prognostic information. This image gives an example of T and M staging for breast cancer. So the T stands for tumor size. Seen here, T1 is when the tumor is not very big. And at T4, the tumor extends to the skin or chest wall. N stands for lymph nodes, and M stands for metastasis. AJCC staging is graded from 1 to 4, but don't worry too much. Stage 4 does not necessarily mean the cancer is incurable. You may be wondering why I keep mentioning lymph nodes and how they are important in cancer. So tumors have the ability to metastasize by first detaching from primary tumor and then entering the blood directly or indirectly via the lymphatic system. Detachment can be passive, where cells are sloughed off from the tumor, or it can be active, involving directed migration. This can depend on the type of cancer. Lymph nodes are found throughout the body. They are important for the body's immune system. Their spread can be predictable as tumors almost always invade lymph nodes in sequence, starting with the nearest node. If the draining or sentinel lymph node is uninvaded, it is likely the other lymph nodes are free of metastasis. Lymphatic capillaries are leaky relative to blood vessels. Therefore, they are often the first site of metastasis, and this is why taking lymph node biopsies are critical for tumor staging and prognosis. For example, 75% of prostate cancer patients with lymph node metastasis at time of diagnosis will have bone metastases within 5 years regardless of treatment. You will then discuss your treatment options with your oncologist and include just one of these modalities or a combination of it. The treatment depends on the type of tumor, its location, and the patient's prognosis. Surgery is one of the options. It includes open surgery with big incisions, robotic-assisted surgery, or endoscopic surgery. The type of surgical method taken will depend on the tumor location, size, health, and the goal of the surgery. For example, to remove pituitary tumors, the surgeon will not do an open surgery, but rather go through the nose to remove the tumor. The goal of CNS is to remove as much tumor as possible, causing as little damage as possible. Surgery is best for solid tumors that are localized in one area and not for leukemia or cancers that have spread. Sometimes all you need is surgery, but most often it is best combined with other treatments. Before a surgeon conducts surgery on a patient, they must consider what previous surgeries you have had, your medical history, overall health, and prognosis of cancer. If the patient's health is not that great, surgery puts extra stress on the body, making it difficult for the patient to recover and puts them at greater risk of infections, which is a big complication for any patient who undergoes a surgery. If the cancer has spread very far, it will be too difficult to remove all the tumors without causing damage. This is the case with many palliative patients, where the goal will instead be relieving their pain and improving their quality of life instead of treatment of the disease. Other complications include pain, blood clots, bleeding, and confusion or delirium due to the use of anesthetics. Systemic therapies are another method of treatment. It includes chemotherapy, which works to target DNA synthesis or cell division to cause cell death. The drug received depends on the type of cancer, whether it has spread and where, and if you have other health problems. Chemotherapy can be used by itself or with other treatments. This can be through neoadjuvant or adjuvant chemotherapy. They can help other treatments work better or kill cancer cells that have returned or spread to other parts of the body. Chemotherapy is typically delivered orally and through an IV, but other methods are possible as well. So chemo may also kill or slow healthy cells. The most common side effects are fatigue, hair loss, ulcers, dry lips, and nausea. Immunotherapy works by improving your body's own natural defenses to fight cancer. Normally, your immune system is supposed to recognize cancer as foreign. The lymphocytes will become activated to attack the cancer cell. However, sometimes what happens is that the cancer cell secretes proteins that blind the lymphocytes. Immunotherapy drugs bind to receptor sites so the cancer cells cannot bind there and trick the immune system. Immunotherapy takes longer to work, and sometimes the tumor may actually get larger before shrinking due to immune cells surrounding the tumor. It may also cause the immune system to become overactive and attack normal tissues and organs. Patients who have had organ transplant may not be a good candidate for immunotherapy. Targeted therapy is also relatively new. It targets specific mutations on the tumor and is individualized. Side effects include fatigue, diarrhea, nausea, and joint pain. Endocrine therapy works by slowing or halting cancer growth by interfering with hormone action and production. Hormones such as estrogen, testosterone, and progesterone can cause proliferation of cells, leading to cancer such as breast cancer, prostate, and endometrial cancer. To use this method, the tumor must contain receptors for the hormones, meaning it is hormone receptor positive. These can be identified with immunohistochemistry. An example of SERM is tamoxifen. Tamoxifen works by binding to the estrogen receptor, and then it blocks it, therefore preventing estrogen from binding, hence stopping cell proliferation. Aromatase inhibitors work in postmenopausal women when their ovaries have already stopped producing estrogen. LH-RH analogs are available for men and women and act as negative feedback to downregulate and inhibit the production of hormones. Normally, estrogen has beneficial impacts on a woman's body. It protects the heart from cholesterol, improves memory, and strengthens bone. But unfortunately, sometimes estrogen can stimulate increased growth of cells, resulting in cancer. Side effects of endocrine therapy include menopausal symptoms, joint muscle pain, and can decrease bone density depending on the drug. Men similarly may experience osteoporosis and menopausal symptoms such as mood swings and hot flashes. Finally, radiation therapy is another option. The goal is to destroy cancer cells and spare as much normal tissue as possible to extend life expectancy and to improve someone's quality of life. Radiotherapy can be curative and is often used in conjunction with other treatments. Adjuvant radiotherapy is commonly done with breast and rectal cancer to help treat areas that are at risk of microscopic disease after a surgery. Neoadjuvant radiotherapy may be used when a surgeon will want the tumor to be shrunk as much as possible to make it easier for them to surgically remove the tumor. Sometimes palliative radiation therapy is conducted where the goal is not to cure the patient, but to help the patient manage their pain, improve their quality of life, and to control the tumor size. Radiation therapy is great as the process is painless, tasteless, and sightless. This is common for patients with bone and brain metastases, which are difficult to treat and often very painful. Radiation therapy can be delivered externally through a LINAC, and this is the most common modality. It can also be delivered internally, called brachytherapy. A radioactive source is placed near or within the tumor. It is beneficial because the very high dose of radiation is directed towards the region of interest, whereas the surrounding normal tissue gets relatively low dose. Side effects may include skin inflammation, hair loss, and vascular damage, depending on the dose, number of treatments, and the area that received the radiation. By combining prognostic and predictive factors together with statistics, an oncologist can better create a treatment plan for the patient. If the prognosis of a patient is very low, the oncologist will probably recommend palliative care instead of curative treatment, as the risk of undergoing treatments may outweigh the benefits. A prognostic factor is a characteristic of the cancer or the person that may impact the outcome of the patient. This includes the type of cancer, location, and stage. Specific patient factors include your age, gender, ethnicity, and how healthy you were before cancer. Predictive factors include how the cancer will respond to a certain treatment. For example, the presence of ER hormone receptors is a strong predictive factor for how well a breast cancer patient will do with endocrine therapy treatments. Doctors also estimate prognosis by using statistics from previous similar cases to help them determine the best treatment option for you, help you decide what you think is best, and hopefully ease some anxiety. Common statistics include survival rates, median survival, overall survival, which is the percentage of people with a specific type and stage of cancer who have not died from any cause during a certain period of time after diagnosis. It directly measures clinical outcomes. For example, breast cancer has a much higher 5-year overall survival rate than head and neck cancer. Therefore, breast cancer has a better prognosis and better survival than head and neck cancer. Disease-free survival are the number of cancer patients who are still alive without evidence of disease for a certain period of time. This can help look at the outcome of treatment. Well, thank you for listening, and also thank you to my class notes and all the sites for their images, information, and music.